So I have myself, I'm Lauren Dudek. I'm our Senior VP of Sales and Marketing at Lumisk, home of CO2Lift. I also have Paula Canavero on the line, and she is spearheading the West Coast efforts. And then I have Jody Weston, who is up in Canada. So happy to have our Canadian representatives here as well. And then, of course, our panel, we kind of have split up a little bit too. So we have East Coast representation, we have West Coast representation, and we have our Canadian representation. And I'll let the ladies introduce themselves here in a little bit, but love seeing everyone here online. So we're here learning about CO2Lift, which is a topical carboxy therapy gel. So carboxy therapy has been done for years and years, dating all the way back to when Japanese samurai warriors would go into carbonic hot springs to heal their battle wounds. And then, kind of developed into an injection form. So they would have big gas tanks, run a line, inject carbon dioxide gas into the tissue. And there was a lot of really great studies that were done specifically on the injection format of carboxy therapy. We have a topical version. So what basically happens is the gas, whichever format you're using, application that you're using, the gas is going transcutaneously into the tissue. The body is responding, almost like triggering it into a hypoxic state. So that body responds by rushing oxygen to the area. Your capillaries are expanding, you're removing waste faster, you're bringing that blood and the nutrients to the cells, and it's essentially kicking your body into its natural wound healing mechanisms, allowing the body to kind of repair itself. So the physiologic effects of carboxy therapy, and I think it's really neat if you just kind of search and Google carboxy therapy, especially the injections, because there are literally a ton of studies on the benefits of using carbon dioxide gas. So from increasing the oxygenation, increasing the flow rate, the vasodilation, it's a natural vasodilator, cleaning out the waste of the extracellular matrix, creating that biostimulation and helping with the microvascular tissular exchanges. So, and also the correction of the pH, so you're getting neoprocollagenesis, you're improving the Bohr effect. And if you're not familiar with the Bohr effect, it's essentially when you lower the pH or increase the CO2 levels, it's going to create that shift in the oxygen dissociation curve, right? So that's essentially the mechanism of action. So I love all of these amazing studies on, kind of more historic formats of carboxy therapy. And, CO2Lift came about in about 2015, officially 2016. Since then, I feel like we've constantly and are always evolving and changing. One of our, I'd say, more highlighted studies was just on doing monotherapy. So, and I think this is maybe the most applicable to our injectors here because it really is helping with skin quality. And especially when you're doing full face filler or doing anything for facial balancing, it can only go so far, right? So you want to also be focusing on the skin quality. And I think that's where we have a beautiful pairing together that can create incremental benefit to the work that you are doing, to your artistry as well. So it's helping to provide immediate hydration. So 117% increase in hydration immediately. Other markers like luminosity, radiance, sagging, pigmentation, fine lines, wrinkles. But I think the most impressive marker here with this study by Dr. Zoe Draelos, who has done a ton of medical research for other medical grade skin care lines as well, which was on the elasticity. So we saw a 26% improvement in elasticity after doing 6 treatments in 1 month, then did nothing until one more at week 7, and then took the measurement again at week 10, 3 weeks later, and it had improved to 28%. So when you can change the elasticity that quickly, and by that significant of a value, it's pretty great. And then you can kind of see where that combination therapy can really come into play. Just a ton of clinicals that we've done since, and I'm just going to kind of talk through some of these here. So the increase of hydration, we have a lot of our accounts that'll use like even a little hydrometer if they don't have a camera to measure the hydration in the skin. It's really great to see, again, that instant gratification. The elasticity, we have a study that was published in the JDD on post-RF microneedling. So that was the reduction in downtime, speedy healing, improved clinical outcomes, and higher patient satisfaction. So again, incremental benefit to those in-office treatments that you are doing for your patients. Where we got kind of a little bit more into the plastic surgery field, we did some wound healing studies. So we did a wound healing study on diabetic ulcers. This was our little pilot study, but we saw 100% reepithelialization or for complete healing in those 10 diabetic ulcers within 1 month. So taking that a little bit a step further, we more recently completed a study that was on venous ulcers. And all of these guys, we have all of our published clinical studies. If you do a little scan of this QR, you can access all of our clinicals, the full PDFs of all the clinicals. So go ahead and check that out. But our more recent one was on venous ulcers. And it's funny because now working with plastic surgeons a lot more recently, they want to know, does this actually work? And I love this study because it really showed the immediate improvement in tisular oxygenation and pretty significant improvement in the oxygenation immediately, as well as 1 month after. And then we also looked at through arterial Doppler, we saw the flow. So we saw the blood flow increasing, the microcirculation, the oxygenation. So really cool to see that we know that we are doing what we're supposed to be doing. And it's very simple in its effect, right? So we're just bringing oxygen to the area. Again, kind of going in with our plastic surgeons, we are now currently working on a 100 patient case study, clinical study for body contouring with Dr. Alfredo Hoyos. And he is seeing prevention and reduction of ecchymosis, hematoma, and necrosis post-surgical body contouring procedures with an overall benefit to aesthetic outcomes as well. A couple other studies that we have coming down the pipe. We have a post-CO2 resurfacing study that we've done with the Mayo Clinic and Dr. Stephen Diane out of Chicago. And we're also going to be kicking off a hair study here, which I think is pretty cool, specifically for FUE hair transplantation. So we're always constantly looking at different types of things. We have a scar study going on as well, but have a lot of really, really great published data already at our fingertips to help give you guys the confidence that in its simplicity, it works. So that's the overview of the clinicals. Again, very numerous applications. I've kind of been saying like from glow up to sew up because you can get that hydration, but then we also have our plastic surgeons that are using it immediately post-surgical procedures. It gives that immediacy. It is very versatile in the effect that it can be used for anybody and everybody. There's no contraindications. I put it on my 6-year-old son when he had a sunburn just last week in Miami. And it's also, there's universality to it as well. So again, not just our injectors, everybody in the office can be using this in different ways, whether it's just a facial or if it's post-laser or it's post-injection. And then it's our surgical techs and our MAs and our surgeons that are using it post-surgery. So a lot of really great indications and really the universality of it. So in a little bit here, we're going to be going through some cases that our lovely panel has brought forward for us. We have a couple of just little pictures to share here too. So again, this was after a neurotoxin, a neuromodulator treatment. And you can see, so this is immediately after the toxin. But here you can just see the better skin quality, right? She has that hydration. You can even see some of those fine lines. So again, it's what we've been hearing is that it kicks in patient satisfaction faster as well, right? So because it has that immediacy to it. And so it's just creating either better retention, better patient satisfaction as well. So it's a great complement to your injections. Microneedling, RF microneedling. Yes, it's going to help reduce the downtime and speed up the healing, but again, it's going to give incremental benefit to those therapies that you're doing in the office as well. So this was immediately post microneedling with the application of the gel and then after the 45 minutes. This is a split phase post halo. So again, we're doing a post CO2 resurfacing. I know we have a lot of people that are using this currently with CO2 resurfacing and the Fraxel and Halo and any device really out there. The only thing that we caution is that if it is something that's a little bit more deep heat, you want to just cool down the skin first, wait a little bit, maybe even 24 hours, depending on the patient. And it's super safe. In fact, with the Mayo Clinic study, we showed that the pH is not changing. So it's just kind of more of a comfort level for the patient, because sometimes if the skin is so hot, it's just because it is a cooler gel, it's just not going to set as nicely as they're used to seeing and experiencing. So, but there's no damage that you're ever going to do if you're doing it immediately after. Okay. So we do have this pretty cool guideline sheet that we just put out. So if you don't have access to this, feel free to shoot us an email. Probably the easiest is to send it to support@lumisk.com or ask your regional account manager. But this just kind of gives some guidelines to our usage applications. So for vascular occlusions, we have a lot of our experts have been using it in the event of a vascular occlusion. If they've had someone come in that might have gone somewhere else, they had the vascular occlusion. And then again, post-injectable, just doing it immediately after and then doing that monthly maintenance. With our laser treatments, we can always pre-treat the skin just to kind of get that skin quality improvement. We have a lot of people that are actually layering it on top of the numbing just to kind of prep that skin immediately and quickly, and then doing for at least 3 to 6 days post. Same thing with your RF microneedling. And any of these can be combined with anything too. I know we have a lot of our providers that will combine this with exosomes. They're putting the exosomes on first and they're putting this on top because of natural vasodilation. They believe that it gives better penetration of products as well. And then of course, in the event of any kind of complications. So this is a nice little guide. It has a PDF that goes right to our training deck with some good before and after photos, the videos from our webinar, from our previous webinars, the instructions for how to mix. This is a little video on Dr. Lee Walker, who I'm assuming if you guys are injectors, you probably know who Dr. Lee Walker is. He specializes in complications and has done a lot in the study for that as well. And this one down here was just an example of a vascular occlusion for male genitalia. So they used 5 treatments in totality. So they had come in on Friday, reversed it, and then had a hyperbaric treatment scheduled for Monday, but then canceled it because they didn't need it because they were able to completely recover the tissue. So really great for literally anything and everything in your office. We, of course, have the vaginal application as well. This is where we have some histologic findings showing the neovascularization, the thickening of the epithelium. So the V is a little bit different. It is a pH that is 4.5, so specifically for the vaginal application because it is going intravaginally. And we have some really great studies on that as well, just showing the improvement overall for atrophy, for menopausal patients. So, and then of course also just for sexual intimacy. So for pleasure, for orgasm, for satisfaction, and then arousal and desire as well. We do have a new site that we just launched on Facebook, and we invite all of our females to join. It is called if you just Google group in the groups section of Facebook, it's the Intimate Wellness Collective. And this is just going to be a place, a safe space for women to share their stories, whatever it might be. Maybe it's, you're going through HRT, maybe you've had a hysterectomy, whether you've used the V or not. Maybe you want to hear from some other people that have used it or they're considering using it. So feel free to join the group and join the conversation. We'd love to have you there. Okay. And this is something that we're doing for you guys, and we're going to be incorporating with our marketing for in-office materials so that you can be sending your patients there as well as a resource. So with all that being said, hopefully that kind of gave a little bit of a background as to who we are, what we do, but I will turn this over to the ladies now. So I will let you ladies introduce yourself. So Julie, you want to go ahead and kick it off, please?
Hello, everyone. My name is Julie Wuis, also known as the Queen of Face. I'm an RN, soon to be NP this week, actually, and I am the owner of the Face Institute in Edmonton, Alberta, Canada.
Fantastic, and congratulations. Hajrie. Hi,
everyone. I'm Hajrie. I am a board-certified nurse practitioner, and I am in Milford, Connecticut, and I'm the owner of the Aesthetics Loft.
Awesome. Thank you. And Natalia.
Hello, everybody. Thank you for joining. I'm Natalia Guzman, family nurse practitioner based in Beverly Hills, California. I'm the owner of Atelier Aesthetics.
Awesome. Well, thank you, ladies. And again, thank you for taking out the time to join us tonight and for sharing your expertise with everybody. So I will go ahead and start. We'll start with Hajrie. Just how did you learn about CO2Lift and kind of what was your first experience with using the Carboxy Gel?
So I actually heard about CO2Lift at a conference at Aesthetic Extender. I just got a microneedling RF device and also a laser device. And again, you have to be really careful after those post procedures with heat. And I was looking for something that is going to accelerate that healing time, because a lot of times people want a great result, but they don't want that 2-week downtime. So my first experience with CO2Lift, all the treatments I do in my office, I try on myself first. And I did my RF microneedling, and then immediately after I do my laser, I cool my skin off with some cryotherapy, and then I made up my own protocol and I put the CO2Lift on my face. And after having it for an hour, I immediately noticed after what would take me 2 weeks to heal, took me 2 hours to heal. Just the revascularization and also the collagenesis that comes with the application took my level of confidence as an injector and as like a skin expert to another total different level. Now with this, it's standard in all my patients and all my procedures. the amount of recovery I've seen and the turnover has been tremendous.
I love that. Thank you, Hajrie, for sharing.
Yeah.
Thank you so much. Julie?
So my first experience with the CO2Lift Pro actually was from my good friend, Dr. Babak Malecki. He is an oculoplastic surgeon, fantastic surgeon with a lot of great knowledge. And he told me to try this mask. And, initially I'm always a little bit skeptical of anything in the industry because like she said so well, you have to try it first. And so the company actually allowed me to do a trial within the clinic where I did 50% of the staff without the mask and 50% with the mask during a laser session. We all got laser treatment on this day. And I can tell you by the end of the day, the 50% that did not have the mask were begging to have it put on because, and you'll see shortly in my pictures, I healed within an hour. And I'm a very sensitive skin type. So I was astounded by how fantastic this technology is to not only reduce the time for healing, but also improve the patient satisfaction by being able to walk out the door and just go on to your regular day. So after I tried it, I introduced it into all of my post-injectables and post-laser protocols within the clinic.
Awesome. Amazing. Do you mind sharing what laser you did?
So you'll see in the photo, I did the Moxie BBL, and every single person that day got the same treatment. And half of us were tomatoes and the other half were healed.
That's hilariously amazing. I love it. Great. Well, thank you. And I love when we can share stories and share resources with each other. So thank you for Dr. Malecki for, introducing this to you as well. And Natalia?
I've been using CO2 Lift mask for, I want to say a little bit over a year and a half, maybe 2 years. And, we're in LA and Beverly Hills, people are always wanting, again, everybody wants to have a really great result, but they don't want the downtime. So I think that's usually the common denominator between all of us. And we were always looking for something that, number one, wouldn't trap the heat, right? Because I did a lot of halo BBLs, we do a lot of cool peel CO2 lasers. So looking for a mask that allows for oxygen to penetrate the tissue was something that we were very interested in. And then we heard about CO2 Lift mask. And we tried it mainly with a patient that we did a halo BBL on, and then another patient with microneedling. And the patient with the halo BBL actually had an incredible healing time. The redness was down by 50%. When you do a heavier laser, it might take a few sessions of the CO2 mask, but she was very, very excited. And ever since then, we became big believers on the technology of the mask. So it was incredible.
Thank you. I love that. Thank you so much. Okay, so next question is, how do you incorporate this into your practice? And in fact, someone had said, so if you ladies can maybe talk to this as well, for an injectable only clinic, what's the best language to use with patients as to what is beneficial? And then as an add-on, or how are you incorporating it into your cost structure if you're willing to share that as well? Especially this is a Canadian account, with the economy and with patients more cautious now, how do you kind of navigate that as well? So if you could maybe, touch on that as well. And then what are the biggest benefits? So since you've been adding it into your regimen. So I'll go ahead and start with Julie.
Yeah. So for us, honestly, it's been a very easy add-in when you tell the patient that the downtime is going to be reduced by more than 60 to 70%. We found that almost every single patient is more concerned, specifically with injectables, with downtime even more than pain. So we have added it in to our packages and patients don't have an issue. It is optional if they want to take it out, but most patients are so happy with it. And we've also seen an increase in our retention because the patients if they're applying it in clinic, they leave and they have no downtime, or they have the option to take it home and apply it there. So they have that independence and they have seen the results, and most patients have come back and bought the 3-pack after, because we added in 1 mask in the protocol, but if they want to come back and they grab the 3, then they do. And we found about 70% of people come back. So that's a big number when you're thinking of patient retention. And, it's not a high cost to save time, to not have downtime. You don't have to miss work. You can go right back to your activities. compared to, swelling for 3 to 5 days post-injectable.
I love that. Thank you, Julie. Did you ever use any other masks? Because, I know a lot of people compare this to a mask, and it really is a gel treatment in its own right, but we still all call it a mask, right? So has that ever been a challenge for you with kind of, mask versus mask and the difference between?
Well, not a challenge for us, but I guess explaining it to patients that this mask is incomparable to the others. There is a huge difference using this mask versus any other mask that we've used, because we do call this a topical hyperbaric oxygen chamber on your face. We find that goes quite well because patients understand that it is a medical treatment when they're leaving, compared to it's not just about a spa treatment or, rejuvenating your skin. It's about reducing the inflammatory response in your skin. So we've seen a fantastic response with it.
Great. Thanks, Julie. Natalia, have anything to add on there and kind of your experience as well?
Yeah, absolutely. We actually, just like Julie said, we incorporate it into our heavier treatments because it's going to reduce the downtime. So when we do microneedling, we have two of them, one which is the glow facial, and then the red carpet glow facial. It has two different types of microneedling that we mix stuff together, and we already included in it, and patients get that, treatment, they reduce their downtime, and they actually come back to get more of the masks because their skin feels so healthy and glowy and hydrated. I do like to recommend it a lot for patients that I know that fly out of town a lot. Being up on a plane can really dry out your skin and make you feel really crepey. So I usually recommend that for patients because you want to keep that skin hydrated. For the lasers, we incorporated with the Halo BBL. We did actually, I really like your question about the comparison with other masks, because we did have the biocellulose mask, which is really great. However, when we used to put the biocellulose mask, it was really cooling for like 30 seconds. And then after that, you could feel that heat trapped in there, which is completely the opposite of what people feel when we apply masks. So that really allows for the oxygen to penetrate the tissue and make that patient feel really comfortable with their treatment and after their treatment, especially with something like a Halo BBL or a CO2 laser. And patients have just been extremely happy with the reduction of the redness and the downtime with it.
Yes, thank you. I love that. And Hajrie, anything else to add on there? Or maybe how you incorporate it with your pricing structure as well?
Okay, yeah. So in terms of injectables, how I incorporate this with my injectable patients, I know that was the initial question. I say this is going to, let's say, for instance, I do sculpture. I say this is going to reduce the swelling that usually sculpture causes from the trauma from the cannula significantly from like about a week to a day. And people love to hear that because they say, okay, no one's going to know that I had something done. That's the biggest fear. A lot of people don't want to know they had things done. So I always say this is a carboxy treatment. I don't say it's a mask. I say it's a treatment that's going to reduce your downtime, reduce the swelling, help with pain, any type of bruising. And as you guys will see in my slides, I actually had a hematoma that resolved in 24 hours from using this mask. Now, in terms of pricing, I'm really transparent. I add it into my package. I add it in. So it's $150. I charge $150 for it. I'm in the States. I don't know what the pricing is in Canada. I think Julie can speak to that. But for me, I add $150 to their treatment plan, and I guess it's kind of, I don't like to give them an option because I know this is the best option for them. I know in terms of when it comes to ablative treatments, I always know if you access heat, it always equals hyperpigmentation. So you want to alleviate that heat so no heat gets trapped. Therefore, by adding this on after their treatments, it just helps their recovery times 10. And people need to understand, people still want to look good. They still want to rejuvenate themselves. So they will find the means to pay for things. And if you word it that way in terms of more of helping yourself stimulate collagen, help yourself more just rejuvenate your skin, they tend to not have an issue when it comes to payment. Again, I personally put this into their package. I don't give them an option. Some people say that's not right, but at the end of the day, I look at results, and when they love the results, they keep coming back, and that's retention. That helps with my business personally.
I think it lends to your confidence in what you do as well. So
correct. Yeah.
That's what Hajrie say, because we're delivering a result. We're not doing anything else but giving a result. So having this treatment incorporated into their treatment sessions, whatever we're doing, is going to enhance that result and the outcome to the patient, and then they're going to be happy at the end of the day. So really, I do the same thing. I just incorporate it into all the treatments so that patients don't really have an option to take it or not.
I'm glad I'm not the only one. Okay. Good.
And then just over the counter, like if you're selling them just a pack of 3, just out of curiosity, do you have like a little bit of a price range that, like, are you about $100 per treatment when they just take it home? Or do you know like about whereabouts your pricing is per treatment for like a take home?
Like a take home, I would say $100. $100. Yeah.
If they buy, all 3, it'll be the 300.
Yeah. 250, 300 if they, something like that. Yeah.
Okay. Do any of you put it on? And someone had asked about, it looks very thick, assuming it's just wiped off and not cleansing then after. Just want to talk about, because I know we didn't really show a video as to what it is, and you guys can, anyone go to our Instagram, CO2Lift Pro, and you can see kind of the applications. But Natalia, just since you're not on mute right now, I want to talk about just kind of how it gets removed. And do you have people that you apply and just send them home, or are they usually doing it in office, or the timing of things?
So it really depends on, I always ask the patient, are you going home right away? If they are, I usually apply it on. Majority of my patients like me to do it unless they're going somewhere after. So we do apply it in the office and they leave it on. LA, wherever you go, it takes 45 minutes to get anywhere anyway. So by the time they get wherever they're going, I tell them just to peel it off because the mask pretty much comes off really easily. I know I saw a question there, how does it stay profitable if it takes 45 minutes? They don't stay in the office 45 minutes. Literally just leave them in the office for like 5 minutes for that mask to really settle nicely. And then they go on their merry way with the mask on. So it's very straightforward when it comes to mixing the mask. So I just explained to the patients how to do it and how to apply it nice and evenly in a thick manner all over the face, and that's about it. Yeah.
Awesome. Yeah. And then sometimes there's just some little residual, and they can just either rinse it off with warm water, or they can take like a washcloth and just kind of wipe it up as well. But most of it, because it is a thick, to the person's point, it is a thick gel. And then when it comes off, it just kind of peels off, and then you can rinse it off as well. Awesome.
Say is I sometimes like to do microneedling with CBD. So anything that's kind of oily is gonna not allow for the mask to set really nicely. So I would say don't apply anything too oily on the skin prior to applying the mask, or it's not going to set in nicely.
That's a great point. And someone had asked about using it with PDGF. If you microneedle with PDGF, would you apply this right after, or should you wait? Does anyone have a answer to that?
So I personally, sorry, go ahead. Sorry.
Go ahead, Hajrie.
Okay. So I personally, what I do after that microneedle, I actually apply like a sheet mask first, and I use some cryotherapy to massage that sheet mask in to cool the skin off. Then after the sheet mask is absorbed, then I put the mask on. So I do PDGF when I microneedle as well, but by the time I'm putting the CO2 on, after the cryotherapy has infused everything into the skin, then I can put the mask on, no problem. And I still also send them home as well with their mask on. I don't keep them in the office for 45 minutes to an hour.
Yeah, we have a little bubble on our Instagram. We call them carboxy, like car in the car, candids. So it's fun. I think it's just fun to see everybody kind of get into it, and they like to scare people in the drive-through, or wave to their neighbors as they're driving.
Yeah,
so.
my patients go grocery shopping after. They don't like, my patients are like me. They don't care. They're like, I don't care. I'm going to scare everybody.
That's great.
Yeah.
I love it. Natalia, or Julie, did you ladies have anything to add on to that with the layering of either exosomes or PDGF?
Yeah, typically what we do is we have apply the exosomes right away after treatment, and then we wait about 10 minutes, and then we apply the carboxy mask. Sometimes patients go home with it on, just drive home, or we keep them here in clinic and remove it ourselves.
Perfect. Okay. Natalia, anything else?
Yeah, pretty much the same. I do the same thing. We do the Toscani polyrevitalizing nucleotides and then Redurin. So I really like to massage that into the skin, wait about 5 minutes, and then put on the mask. Again, the only thing that I found was not very effective is when I did CBD microneedling on top. So that's just a little too oily for the mask to set in nicely. But with everything else, it goes on beautifully. Just make sure, even with lasers, with ablative lasers, you do, and I think you mentioned that, Lauren, you want to make sure the skin cools off a little bit before applying that mask, just because the mask won't set in as well either, and it won't stay on the skin pretty if it's too hot.
Yes. Yes. And we do a study that we have coming up with the Mayo Clinic was on fractionated. And I know we have a question here, I believe, on fully ablative. We have a couple of doctors that are testing that out pretty successfully so far. So more to come on that. As of right now, what we're saying is if it's a fully ablative CO2 resurfacing to wait 3 or 4 days. I know, again, we do have some physicians that are kind of testing that out right now to see kind of what would be the best protocol. Yes, thank you for that. Okay, great. Well, let me just see if there's any other questions that we kind of more, if you are applying like an exosome or the PDGF or polynucleotides or anything like that, are you having the patient wash off, or when they remove it, are you like, what are you having them do afterwards? You kind of want to keep it all intact, right?
Yep.
Yeah.
Keep it intact. And I noticed if you apply a thicker layer of the mask, it's way easier to peel off versus thin. So just making sure you're applying very thick layer across the whole face, and you can just easily glide it off without having to use water.
Yeah, I love that. Yeah, I think the layering, it's absolutely great and easier for removal. If you have something else, like if you're putting it over top of an incision, or if you're putting it on top of another topical. Where I've seen it in a more thin layer is more on the body contouring. Like if they're doing it on the body, if they're doing it on full abdomen, or if they're doing it on the flanks or on the breasts, and then because then they're just using it when they go to, they're just showering it off because there's nothing that they're using or compromising underneath as well. So it's just easy just to go and rinse it off in the shower. Okay, great. Well, let's kind of shift gears here a little bit and talk women's wellness. I'm not sure if all of you ladies offer the CO2 Lift V, but just talking about what that conversation looks like in your rooms and with your patients, and how you're navigating those questions. What else are you offering? And then how does CO2 Lift V kind of fit into that as well? So, Natalia, we'll start with you.
Yeah. So for me, in terms of the conversation with patients, I like to introduce them to both the CO2 Lift face and the CO2 Lift V mask. And I like to enhance, to like really bring up the fact with patients that we don't usually talk about women's wellness and health. And that's how I open up the conversation with patients. I don't offer any intravaginal treatments, but we do offer the V mask because I think that we really need to open up that conversation with our patients. I have a range of patients from early 20s to their 70s, and wellness for vaginal health is important for women. So I think that we need to be more open when we're talking about it. And that's how I open up that conversation with them.
I love it. Thank you. And thanks for offering it to your patients. Yes, ladies.
Same for me. I don't have any vaginal rejuvenation devices in my office, but a lot of my patients who I have a lot of that are postpartum mothers or have that stress incontinence, I do, and they ask me like, do you know what I can do? And I don't want to do surgery. I say, well, this is a great option for you just to help with that incontinence or that, any type of vasomotor symptoms or any postpartum issues they have, like again, stress incontinence. We always emphasize sunscreen for our face, right? But no one really likes to talk about women's health and vaginal health, but I make it more normalized in when I see my patients, I'm like, how's everything going? And I include that in their treatment plan as well, just because it's good to feel, okay, this is normal for me to talk about, and it makes them more trusting with me. So just opening that conversation, maybe they feel weird the first time, but other time around, they're like, you know what, since you did mention that, I do have that. They're kind of nervous and shy. So I just try to normalize talking about vaginal health in the beginning, whether they want to speak about it or not. Eventually down the line, they open up to me.
Yeah. Thank you for that. Appreciate it. Yes. Julie?
I'm very similar to you both in that, but we also have a vaginal rejuvenation device. The one thing is, though, that we always found a gap before receiving the CO2Lift V was that not everyone was a candidate for it. So some of our patients are not allowed to have the treatments. But if they can, we do pair it with all of our treatments because it's internal and external. So we can do radiofrequency microneedling inside and outside, as well as the plus 90. And we found that the patients are having accelerated healing and results when we do pair it with the CO2Lift V. But the other side of the coin is if we have a patient that, let's say, can't have the treatment, we have a project called the Yellow Balloon Project where we treat breast cancer patients. We have a lot of them and we treat them post chemotherapy. And it's something we don't really think about. They can't use this technology, but we're decreasing their estrogen intentionally, which is causing a whole host of problems for these patients. So, they're just begging for help with this, where they have vaginal dryness, their sexual intercourse is painful, incontinence, pretty much everything which requires estrogen is happening for these patients. So we typically give them the pack of 5, and then these patients are repeating it. And we've seen great success with it. They're coming back saying there's such a difference in their life and especially in their relationships. So it extends beyond just the everyday patient into, dealing with very severe conditions.
I love that. Thank you so much. And that actually answered one of the questions, was pairing it with the RF devices as well. And yes, we do definitely have some great studies on the vaginal as well. That was where we actually saw the histology of it, where it was thickening the epithelium and also just helping with quality of life too. So with the female sexual function index, and we even looked at bladder life, in our most recent study. We had done actually incontinence and, goes into claims and FDA stuff and all that, all of that. So, but we did it through a qualitative questionnaire. We just asked about bladder life, and a lot of people had mentioned that was a great benefit and improvement on that side as well. And that was my own personal experience too. It was just with incontinence post baby. So yes, as far as, let's see, there was a couple of, what are the applications for pre and post? So, it's just going to depend on the severity of the symptoms, right? Like you said, Julie, you do the 5-pack. If you're doing it in combination with something else, you might not need as many. We always recommend a series of 5 to 10 and then monthly maintenance, right?
Right.
Great. Awesome. Okay, well, thank you, ladies, for all of that. I think we're going to go now into our cases. I know I still have quite a few questions here, and so I'm just going to kind of filter those in between everything. But I'm going to turn this over to start with Natalia, just so you all can see some of these amazing results from our providers here. So go ahead, Natalia, if you want to talk through the first case here.
Yes, so this is my beautiful patient. I did Sculptra to her face, and you can see it looks like she got into a fight with Mike Tyson. And obviously it looks like she lost, but she gave her the CO2, she purchased it, she got it, and she applied it. And this is immediately after. And, those bruises that you see on the before picture, she would have been with those bruises for weeks had she not done the CO2 mask. So we can see here how we can definitely cut down the downtime on patients with bruising post, whether it's Sculptra or a filler or, even radiofrequency microneedling with Morpheus 8, because I do know, I've used Morpheus 8 for a long time, and you can really give some gnarly bruises to patients, especially in the under eye area. And you can see, she has a nice big bruise right by her eye there, which actually looks much, much smaller now. And you can also appreciate how nice and hydrated her skin looks and glowier after. And she hadn't applied anything that made her shiny or anything. It was just the hydration achieved by the mask on her.
It's
a really good result too. Great result.
Very happy.
Yeah, a lot of people have talked about like the maleficent cheeks that you get with that, and just helping to calm down that a little bit. Have you seen that a little bit as well, Natalia?
Swelling. I mean, you're allowing for oxygen to penetrate the tissue, help it calm down, bring down the inflammation process that is happening post injury with any of the treatments that we do. And she healed in less than half the time that she would have on a normal day if she hadn't applied the CO2 mask on her face. So she left it on. She actually didn't go with the mask on, went home, applied it, and left it on for 45 minutes. She actually also lived by the Palisades where the fires were happening. So she was complaining about her skin feeling really, really dry and really crepey. And she's just like, I just need something. And, we chose to do mask and Sculptra together, and that gave her a really good result.
Very, very beautiful. Absolutely. And this one here?
Right. So this is a beautiful young lady that had microneedling. This was her first time doing microneedling. And you can see on the left-hand side how red and, just sort of inflamed she looks, which is normal, especially on the neck. The neck is a thinner type of tissue that we have. So that takes 2 or 3 times longer, no matter what you do, to heal. And she applied the CO2 mask, left it on after microneedling, mesoneedling, and she pretty much the next day had nothing. It just looks really nice and hydrated, and the redness was completely gone by that time. So the next day she was able to follow, keep on her life like a regular basis with no downtime.
Love it. Yeah, and it's funny, I can see like even a little piece of the gel right there. So you can see it was immediately after, yes. At first I was like, oh, but she doesn't have her earrings on, but I guess she took them off after for the application, right?
With anybody, this was her first time, and she actually was really nervous of the downtime. And every time you do something for the first time, if you can give that comfort to patients and even clients, if you're doing like a waxing job or anything like that for estheticians, applying this would soothe and calm the skin down and hopefully help prevent any type of breakouts or any irritation to the tissue, and even getting post-inflammatory hyperpigmentation post waxing or lasers for laser hair removal. I think this would be a great option too.
Some of the questions that were coming in, like, could it be used for a laser burn? Are there any contraindications or any incidents of any reactions that any of you ladies have seen with using the CO2 lift?
So for me, single person that gets anything ablative, laser, microneedling, I stack treatments. I know it's not common, but I do microneedling, laser together at the same time. I've never had an issue, and that's standard for every treatment I have. They get this treatment on their face. And again, I put that into the pricing.
Yep.
And I've never seen a complication with it, but I have used it to fix complications. So anytime it's nice to have it in the toolbox, because anytime there's something that comes in the clinic, whether it's complex or a complication, 90% of the time I throw the mask in the mix to fix it, because whether that's bruising or excessive swelling or a burn, even a sunburn, we've used it several times. I know some people here are from Hawaii. I used it on my sunburn in Hawaii and it was healed in half an hour. So it's pretty much can be used for anything that is compromising the skin.
Well said.
Yes, love it. Okay, great. This is your last case here, Natalia.
Yes, this is my last case here. My beautiful patient. She actually is an injector too. She's a physician's associate, and we did cool peel on her. So laser in a much, much more tamed fashion, and Sculptra, which you can see she has a few little bruisings there. I tend to punch people really hard with Sculptra. And so she applied this CO2 mask. You can see it's reduced her inflammation. Actually, you can see she looks kind of puffy on the before picture and a little bit more slimmed down on her after photo. So the redness cut down by half, literally 0 downtime after her cool peel laser. She's actually told me she felt the skin really cool when we put it on, because there was a little bit of heat that was on her tissue after the CO2, the cool peel the laser. And once we applied the mask, she was extremely happy because it didn't feel as hot like a sunburn. And again, we reduced her downtime by half of what she would have, especially with a darker skin pigment, trying to avoid any kind of hyperpigmentation or anything that has to do with the heat.
Amazing. Yes. Ladies, do either of you ladies, Julie or Hajrie, do you do cool peel as well? And are you using it with this or have similar experiences?
I don't have a cool peel. I have an Aerolase. I don't have any fractional devices just yet, but I have seen it with my colleagues who have it. I try to bring them on like the wagon, and they use it themselves, and it's been a tremendous result I've seen.
Yeah. Julie, we'll kind of just go right in here into your cases.
Perfect.
If you want.
I'm literally first case, me. So I'll kind of go through this. This was actually my first experience with the CO2 mask. And this is what I was saying when I was astounded by the outcome. on our laser day. So on the left, that's me pre-treatment. And in the middle, this is 1 hour post-treatment. So my face was completely healed after the laser. I only had a little bit of, redness on my nose. But that night I was able to go out, go to dinner. There was no issue whatsoever. It felt like I just had healed skin. And then on the right was the next morning. So you can see my swelling is completely down. Inflammation is completely down. My skin is hydrated and very bright. So yeah, this for me was the day I incorporated the mask into all my protocols trying this. So yeah, and with this, with all of our patients doing the Moxy BBL specifically, incorporating this, every single person responds pretty much in this way because it's non-ablative, works really well to just heal the skin within an hour to 2 hours, if not a day.
Love it. Amazing results. Beautiful patient.
This patient here, she's 70 years old. Thought she'd be a good one to show because as we know, with patients that are more mature, 50s plus, they have a loss of elastin and they have some lower lymphatic drainage under their eyes specifically, and usually in the mid-face. And whenever we're using a cannula, which many of us do just for safety, we're going to increase the edema in the face with the mechanical tunneling that's required going into the subcutaneous area. So on the left, you can see she's swollen quite a bit from me doing just a half syringe with a cannula in her mid-face. So I applied the mask, and on the right, you can see this was only 40 minutes after. Her swelling reduction was at least 60%. So she was very happy because she has rosacea. She's a very sensitive patient, and we were able to bring that down.
That's amazing. And you can even see just the hydration, even like around her fine lines around the mouth as well. Just the improvement in the I don't want to say crevices, but with the wrinkles and lines as well.
Interesting enough, on the left, you see how her eye orbital rim there is a little bit swollen. That was not injected. And that was what it looked like prior to injection. So on the right, her swelling around her eyes completely dissipated. So wow. She bought packages of the masks to take on her vacations because it healed her skin and helped with her lymphatic drainage just in that session.
I love it. I had a couple of questions here about smaller packets, and especially for kids and whatnot. I mean, I'll just use a little bit on him and then use the rest on myself. And at this point, it would actually cost more for us to make smaller packets. But I always say there's always somewhere that you can use a CO2 lift. So if it's just like on a little area, like I was at a conference last weekend in Miami and my heels got all butchered up, and, put a little on there and put the rest on the face. So at this point in time, we're not going to be doing smaller packets, but putting it all the way, like using it around the eyes. So you're going lash line to lash line, right? So covering the eyelids and right, you can go right up to the eye line. Yes, absolutely. Well, thank you. That's absolutely a beautiful result. And this one right here.
So this is my Sculptra patient. So we used a cannula to deliver the Sculptra on her on the left here. And as we know, we use quite a bit of fluid when we're injecting Sculptra to just dissipate the granules throughout the face. This patient felt after procedure that she was a little bit puffy, felt a little bit sore and pain. But to the right, you can see after using the CO2 mask, completely healed within 40 minutes. She stayed in office so we could get this photo, and she couldn't believe how she just went completely back to herself. One question that did come up for me in the past week was, well, why would we use CO2 mask when we're trying to get an inflammatory response with Sculptra? And my answer to that, well, Sculptra, we want to have productive inflammation, which means we have controlled fibroblast activation with gradual collagen regeneration compared to excessive inflammation, which is what we don't want. Because excessive inflammation with Sculptra is going to lead to irregular collagen formation, nodule formation, as well as fibrotic tissue concerns. So long-term with Sculptra, incorporating the CO2 lift in the treatment is actually going to prevent you from having complications long-term. So they work synergistically together. They don't compete. They work as a pair.
I love that. We get that question so much, even like with rosacea as well, with the with the inflammation and our inflammatory response. So I think you just answered that absolutely beautifully. Thank you so much, Julie.
Thank you.
Okay, Hajrie, go ahead and want to present some of your cases here.
Well, this patient is me. So this is my face immediately after I did. So my cocktail for me in my office is microneedling, lasers, and then applying the CO2 lift after. And this is literally an hour after. I have so much redness, and I am a very sensitive skin type. I burn easy in the sun, and here, as you guys can see, my swelling in my face has gone down tremendously. My skin color has gone back to normal within 45 minutes. I do personally put people under the red light for 30 minutes while the mask is like settling before they go home. I was still working when I had this on. People thought it was crazy, but time is money. So I was still working, treating patients with the mask on, but I'd like to take this picture just to see how dull and actually irritating my face was. And then immediately 45 minutes after, my face was completely back to baseline. And the next day I was wearing my tinted moisturizer with some SPF with no issues.
Beautiful. I love
Mhm.
it. Yes. And you have some really good.
So this is why you don't inject yourself. This is a terrible, terrible thing. But I was very impatient. My best friend was on vacation. And, as women, I'm always looking at myself like, what can I do? And I was like, well, let me just do my temples. Yeah. So I have a ultrasound in my office. So luckily this was not a vascular occlusion. I just really nicked my one of my like superficial capillaries. And I was like, oh my God, I don't want to look like a psychopath. So what can I do? So I was like, let me just put the CO2 mask on. As you can see, immediately before and after, an hour and a half after, the bruising has subsided. Then the next day when I woke up, I put another mask on. And then within 24 hours, my hematoma was completely subsided. So again, reiterating that oxygenation, increased oxygenation, revascularization of the tissues when this mask is applied tremendously reverses any types of complications. Thank God this wasn't a vascular occlusion. And I always say, even with my patients that are injectables, they get bruising. You can't avoid every single capillary in the face. Incorporating this in your treatment plan just helps quality of life. I was able to go about my day. Imagine if I kept this, my hematoma would have spread. I would have looked crazy. People looked at me like I'm nuts. So applying this really changed my life tremendously. And ever since then, I did this. I've had standard practice. Anyone who's going to get a bruise after a treatment, I just throw the mask on.
Perfect. I love that. Thank you for sharing. And then
Yes. So again, this is my other treatment here. So again, for this patient, I did Sculptra, microneedling, and then laser, and then I did a CO2 mask. This is actually she only wanted it for 30 minutes because she had to go. So what I did for her is she called me right away when she got home and she said, what did you do to me? I said, what do you mean what I do to you? She's like, I'm not red. I'm supposed to be red. I said, no, you're not supposed to be red. So again, she's a sensitive fits type 4, I would say, for her. And it just helps her recovery so much. The thing is, I wanted to show her because she has an issue with hyperpigmentation. And I always tell people heat equals hyperpigmentation. Once you trap that heat in, it's over. Whatever you just did, it's going to totally make it worse. So for her, she was so nervous to do any treatments with me. So I didn't charge her for the CO2 lift this time because I wanted her to trust the process. So with her, I did microneedling, laser. I did use to cool the skin off before I put the CO2 on because it's occlusive. I did do a cooling cryogen therapy on top of like a biocellulose mask. Then I slapped the CO2 lift on, and she has amazing, tremendous results just from having this mask on.
I love it. That's perfect. Yeah. Thank you so much. Ladies, we have quite a few questions, and I know we're kind of coming up, or we've come to an hour here. So I'm going to try to go through some of these fairly quickly, but appreciate you guys sharing all of your expertise and how you've been using this. This has been phenomenal. Has anyone used it with PRF injections? And someone had asked, like, will it bring down the swelling post PRF?
I do a lot of.
Yeah. Go ahead. Sorry, Natalia. Sorry.
Sorry. And it's incredible for that, especially tear troughs with Easy Gel can cause quite a bit of inflammation, especially if you're a little too superficial. So applying this post-treatment with Easy Gel is phenomenal for that. And also I saw a question about it with Skin V too. It's great for that.
That was my next one. Perfect. Thank you.
Help with the hydration of the tissue and allow for that product to penetrate even better.
Fantastic. I know some people we've never done a study on, if the red light can penetrate the gel. I know sometimes people will do full body or anything. So we don't personally have a study on, combining the red light with the CO2 lift. I always just say that's provider preference. Let me see what else. I know someone was asking about and I'll address kind of on the surgical side about applying it on the body. What our surgeons are doing is they'll use just a plastic or a cellophane wrap to cover it so that you can put your clothes back on, or even putting on the garments as well. So to keep it from, getting all over. And then it can stay on longer as well. It doesn't have to be limited to 45 minutes because the plastic will actually keep the moisture in. So it can, like, some surgeons are even leaving it on for 24 hours until the next, dressing change. And then for blepharoplasty, someone had asked about blepharoplasty. We have some great examples of blepharoplasties as well on our CO2Lift Pro page. So you can see that there's some in the plastic surgery one, in the little bubble up at the top. You'll see a great case for a blepharoplasty. Someone had also asked about acne. If you look in the little wow bubble, amazing for acne. Phil, you're shaking your head. You want to talk through just any acne patients and acne specific instances?
Yeah, pretty much anything inflammatory, this mask is your rescue. So anything inflammatory, whether that's acne, whether that's, excessive swelling, bruising, it just pretty much works for everything. Also, I was thinking too with, we'd use it with the surgery, but also I did bring it in as a test in the emergency for pressure ulcers because we have a clinic for diabetic feet, and it worked pretty much every single time after 5 sessions. So yeah, it's extremely effective for almost anything to do with healing.
And we're praying that with any, we're injectors, and for us, it's not that it'll never happen. I hope it never really does, but in the case of an occlusion, right, too. So always remember you can use it for an occlusion to help and put it part of your protocol when you're having any issues like that, or even when in doubt, just slap it on.
Yeah, like having an emergency kit, have the CO2 in that emergency kit.
Yeah. That's actually what Dr. Lee Walker was doing. He's putting together like a VO complications kit and including us in there as well. So, and that's what our study with Dr. Hoyos is showing, that, it actually could be preventing necrosis and preventing complications as well. So I love that you said that as well, Julie. What about chemical peels? Are you guys using this in combination with any chemical peels?
Yeah, I apply it after the chemical peels. I actually do it 24 hours post peel. I want them to keep on the peel for a little longer. We do VI peels here. So, helping with the hydration for the skin so it doesn't feel too itchy when they're peeing. It's important because it can be extremely uncomfortable when people are really itchy and they don't know what to do. And instead of putting a more occlusive, possibly a, product that is going to make them break out or cause any more issues and clog the pores, utilizing the CO2 mask is really great to help them with that issue.
Yeah. We say once it's neutralized, it's safe to use. Go ahead, Hajrie.
Yeah, I was going to say, same with me. I use Bio Repeal. And instead of telling them to use like Aquaphor after, I'm not a fan of Aquaphor because, again, it's so occlusive, it traps heat, makes them break out. I have them put this on, like Natalia said, 24 hours after, and they have no issue.
Awesome. Is anyone using it on top of the numbing to pre-treat prior to energy based? And I know one of the questions here was, if you could only choose before or after, which one would you choose? I've always said, like, it just depends on what the patient's looking for. Like if they've never used a medical grade product, if it's the first time that they're in your chair, they need hydration, it's great to pre-treat. Some say that it's helping with comfort as well. So that would be another instance if someone's a little bit more nervous or, worried about pain. Otherwise, I would say, you're going to get more bang for your buck as doing it immediately after, if you could only choose one. But I'll toss that back to you guys, to you ladies, and what would you say to that?
Yeah, if it's in the patient's budget, we definitely prefer to pre-treat and applying it with the numbing because the numbing works faster and is more effective. And then it also reduces the redness and inflammation. And because we're in Canada and it's so dry here, we don't have a lot of humidity, it will help their response with the laser because if the laser is attracting to water within the skin and they're very dry, it's going to be less effective. So we use it as a pre-treatment. And then if they buy a pack of 3, then we'll do one immediately post and then one for the next day if they're able to do it.
Love it. Yes. Natalia, did you have anything else to add there?
Yeah, sorry, my phone just fell. I don't do it prior to. However, for many years I did morpheusate, and I wish I had done that before because Morpheus 8 is not the most comforting treatment to do. So if you have treatments that you know that are kind of painful for patients, I think this would be something great to incorporate into the treatment again. Because look, if you give the patient an option, they're always going to want to go the cheaper route, right? And that same thing happened with healing skincare. I include everything in there. They kind of feel like they're getting something for free, which technically they're not. They're still paying for it, but they just feel like they're getting something, and everybody likes to walk out with something. And I think that works really well. So if you're doing like a tattoo removal, if you're doing something like electrolysis for removal of hair, I think that's pretty painful. I've never had it, but I've heard it is. Morpheus 8, I think it would be a really great option. And if you're treating, I found that if I'm treating face and neck, you kind of need a couple of packages for everything to be covered. So always keep that in mind. If you're going to be doing larger areas, you may need a couple of the packages of the mask.
Mm-hmm. Yeah. Yeah, we say one per area, and one's usually like for the face. So if you're going to do face, neck, décolletage, yes, and you can just mix them all up together in the one. So, Hajrie, do you use it with numbing at all?
Sorry, my phone was like frozen. I do use it with numbing. I also have a Morpheus, and like Natalia said, like it hurts. So what I do is I put BLT on. I use 20-20-10, and then I put the Morpheus. I put the CO2 the gel mask on, and it just helps them tremendously because you have to go to certain depths to get a result. And before I wasn't seeing results because it would hurt, and I don't want to inflict pain, and then I don't want my patients to hate me. So what I've been doing, yes, is putting that on, and it helps them be comfortable, and slapping one on after just helps them heal faster.
Yeah. Sally had asked about before old therapy. Anything that that wants water, right? That wants to have more hydrated skin is amazing to do with a pre-treatment as well. Yeah, the benefits after kinetic dermabrasion or high frequency old therapy treatments, they only do that, but it can absolutely be beneficial for that. So thank you for those questions. Post PRX, absolutely. That's kind of going back to the BioRePeel and the chemical peels. They're a great combination. I have a couple more questions about, there's one about the Plexer Plus. They usually use it after the carbon crusts fall off. Could they apply the treatment immediately post Plexer to help reduce inflammation? If so, would we have the patients use one daily until the swelling subsides if necessary? Anyone use a Plexer or do any kind of, what can't I even think of what that's called with the little points, right?
Fibroblast pen?
Yes, thank you. Thank you.
I don't have one in clinic, but I know quite a bit about it, and I definitely would be applying this daily with that device just to prevent the inflammation and pigmentation that can come with it.
Especially darker skin pigments, you want to make sure you keep that inflammation and heat down at a max as you can. Yeah.
Yeah, because like remember, heat is hyperpigmentation. Once you trap that heat in, it's all over. They're gonna start back to zero. They're gonna come back to you, complain that they're gonna pay more. So I would just put it on just to help prevent that.
Incorporate it in your package. Don't give them.
Yeah, no, nothing for free. No, it's always in it.
And the pH of this is 5.5. And again, when in their study that will be published shortly, we saw that the pH did not change. So great. I know Bill asked about using it for FUE. So the study that we're doing right now is more so on the pre-treating on the donor and the recipient site. So not necessarily immediately after the grafts, but their hypothesis is that it will actually help with the graft take and the graft growth post FUE. So really excited to see that. Definitely before old therapy, soft wave, all of that. Carolina, thank you. Yes, you can use it before the crust form. So some questions for the V. Any contraindications at all for either the CO2Lift or the CO2Lift V? Any contraindications that you ladies can think of, or anyone that would not be a candidate for it?
I say if somebody has like an active cold sore, don't really use it because you're perfusing that area and it could make it worse. I do treat my patients before they do any treatments with me with the lips. I put them on acyclovir, but if they have an active, I don't treat them with it, with anything. That's the only thing I can think of pertaining to that.
Yeah, I think any infection going on the skin or anything like that, I would probably stay away from that. Probably use it after when they've healed, if there's any scarring or anything like that, probably. But other than that, I wouldn't do it on anybody with infection.
Mm-hmm. Yep, absolutely. That's what we say. We say make sure that the infection is being treated first, and then they can go right into using the CO2 lift. Other than that, I mean, we've seen just some people are more sensitive to a product because it could potentially have deeper penetration. That's maybe the only time that they would see some kind of reaction because it's just deeper penetration. So it might be additional purging or, kind of just more sensitivity to a specific product like a niacinamide or retinol or something like that. But other than that, we don't have any contraindications for the CO2 lift. There is a slight orange extract, natural orange extract. I don't think many people have an orange allergy, but that could be a potential one. And then for the V, we just don't have any studies on pregnant females. But they're using it kind of week leading up to birth. At least that's where our doctors are saying safe to do week leading up and immediately postpartum. That was also another question. And thank you, Marta, for sharing that you are using it with your post upper and lower bleph and that you've been healing amazingly. I love that. Thank you so much.
I think one thing is to keep in consideration if you're using the CO2 mask prior to numbing, and I don't know, Harry and Julie might want to talk about more about this because I don't use it for numbing, but just keeping in mind not to leave the numbing cream for too long on there. So just always be careful with numbing and something that's going to help penetrate it even more.
Correct. Yes. Sorry, thank you. I forgot to mention that. Yeah.
And most of our providers are saying if it's on the face because of the surface area, you're fine. If it would be like on full body or full stomach or something like that, then that would be the only kind of, potential for
toxicity.
Toxicity. Yes. Okay. I mean, I hope that I answered everybody's questions, but you can shoot us a DM. You can email us support@CO2Lift or support@lumisk.com. We do have an amazing promotion. So typically the cost of the treatments are between about $45 to $50 each. For those that want to just try, maybe do a couple of cases on your own, I do recommend, and again, we have the sheets that kind of go through the recommended guidelines, but a series of 3 with every patient done 1 a day and then 1 a month for maintenance at a minimum. So we have a 15 count box that would be, for 5 patients for $600, so $40 each, US, $47 for Canada. So that's for our newer injectors or newer practitioners that want to try. And then any of our accounts that are on the line, if you want to order before the end of the month, we're doing a really nice promotion. We have a couple things going on right now, but this is kind of, best pricing that we've offered for a while. So 30 treatments, and that can be either singles, 3 counts, or a 15 count. And then you would also get a 3 count for free. So if you want to take advantage of any of those offers, you can email support@lumisk.com. You can DM us. We can connect you with your rep, or of course, ask your local account manager as well. So happy to have those nice little offers there for you guys. And because we appreciate everyone taking the time out to join us here. Any other parting words or anything else to chime in on here?
I would say just, this is a great addition to your practice. Anybody, whether it's estheticians or injectors, I think that anything that can, number one, enhance the results of the patient and anything that can help cut down downtime and help with pain, I think it's absolutely worth it for investment for the patients.
I agree. Like as long as it's something that's not that cost effective to where you're going to break your bank with it. And at the end of the day, you're increasing trust with your patients and you're increasing results. And that's what's going to drive your business. I'm a solo business owner, and this is one thing that helped me, patients trust me, is them seeing results quickly and having minimum downtime. So it's something that just helps you along. And as a business perspective, as a business owner, it helped me tremendously.
I couldn't agree more. And I believe as business owners, if we can extend the care, not just from being in the chair to outside of the chair to at the patient's house where they're getting exceptional results from us, that's what they're going to remember. And that's going to give us the best reputation in caring for them. So
I love that, Julie. Thank you. And yeah, it's so fortunate that, and someone actually asked about the difference between our consumer version and the pro version, and the pro is only sold through providers. But the great thing is that it doesn't have to be applied by a provider. So it's brought to you by your providers. And so it's something that they can have trust in because they have the confidence in you, but they can be easily doing this on their own at home when they're in Hawaii on the beach or wherever. It doesn't have to be necessarily done in the office. It's a great option for them to do at home as well. So thank you for bringing that up as well. And ladies, thank you again so much. We appreciate all your time. Thank you all for those that stayed on here. We hope you found it very informative, and the replay will be available to anyone that was not able to join live. So thank you to all for joining us at a later date, and have a great evening. We appreciate you.
Thank
Thanks
you
so
for
much.
having us. Thank you
So much.
Thanks, ladies.
Appreciate it.
Bye.
Bye.